Our goal when we started this was not to take the place of a primary care physician. It was to bridge the care because in Eastern North Carolina we absolutely have access issues. So what can we do to actually treat them until they can get there so they can avoid that ED visit? No, the employers cover the entire cost and they look at it as a win-win because then the employees do not have to leave work to go sit for hours at a physician office. They are getting timely care and they're able to return to work hopefully in a safe, quick fashion.
With regard to time away from work, we feel like if employees are sick, they're going to be off from work anyway. And we'd rather have them using our clinic where their visits are shorter than if they were to go to a provider and have to wait and maybe not return to work at all. We're steering employees away from those high-cost emergency room visits to some extent, and also the higher-cost urgent care visits. So we're hoping to see employees sooner rather than having them wait until their condition worsens and then their higher costs.
And the great thing about a lot of these clinics is they've opened it up to spouses and their dependents. So, you know, as a mom having 4 kids and then needing to go get my kid tested for strep, I could come here with virtually no wait, minimal risk of exposure too.
Even since we first opened, we've added some services. Since we've opened, we've added an on-site pharmacy, for instance. We've allowed children 13 and over to be able to attend, you know, if they're covered under their parents' health insurance coverage. We've allowed our retirees, who are big utilizers of health insurance, we've allowed them to use the clinic services.
Even with insurance, there's deductibles, and that's a barrier for some of the clients that we serve. They don't have money for those deductibles. And also in our clinics, we provide medicines. We have a limited formulary, but we do provide some medication, and it's free of charge. They pay absolutely nothing. They're walking out the door, they've been seen, and they've been treated. So I think that that is extremely important, especially at some of our companies like Grady White. I mean, they make very little. And then yes, they have insurance, but then when you go to a physician's office, right, but they are expecting then to, you know, have to pay, and they don't have to pay a dime to come to our clinics.